As city and state leaders struggle to find a way to keep Topeka's St. Francis Hospital open, one employee says he's come up with a way to save the hospital without finding another owner.
New at 6, KSNT News reporter James Ryan talks to one man who says community support for St. Francis could be the very thing that saves it.
Instead of searching for another owner for St. Francis Healthcare, one employee says that he thinks there's enough public support to keep the doors open as a community-funded hospital. Last week, SCL Health announced they would close St. Francis Healthcare in Topeka if no one came forward to run the hospital.
When I sat in the town hall and heard that the doors might be closing in a week and a half or 2 weeks, my heart hurt.
Supporters have until early May to come up with an alternative for the health center. Derek Hodum has worked at St. Francis since 2001 and says there's one option that no one is talking about.
As a community, we could come together and support and fund this hospital. I've worked for community-based hospitals before. I know that they're viable options.
Hodum says St. Francis could be funded through an earmarked sales tax or a property tax increase.
I think that would be a good idea.
So you'd be willing to pay more in property taxes?
Just for the hospital to stay open, yeah.
While many in the community have shown support for the plan on Facebook, others acknowledge it would be a tough sell.
Everybody's already strapped for cash.
Sherry Collins goes to St. Francis for dialysis treatments. While she thinks it would be a good idea to make St. Francis a community-funded hospital, she says there's a lot of people that are hurting financially.
They complaining about when they can't find a job here or they can't do this there, and so it gets kind of tough.
For now, the hospital's future is uncertain. Hodum says that he's heard that another company may be interested in St. Francis, which he would be fine with.
And if that's what happens and it keeps the doors open, then I'm all for it.
He just thinks a community-funded hospital would be better than no hospital at all. James Ryan, KSNT News.
Hodum acknowledges that he is not a tax expert and says he's reached out to city and state leaders to figure out if it's a viable plan.